Level 1. Uninsured. The pain in your side started 2 days ago, and you waited, because waiting is free and everything else has a price. By the third night, you can't stand up straight. You drive yourself to the emergency room because an ambulance is $1,200, and you've heard the stories. At the front desk, a woman behind the glass asks for your insurance card. You say you don't have one. She doesn't react. She just clicks something and a different screen comes up, the one for people like you. You sit in the waiting room for 6 hours, not because your case isn't real, because the system triages by emergency, and a kidney stone that hasn't killed you yet can wait. When they finally see you, it takes 9 minutes. A scan, a prescription, a printout that says follow up with your primary care doctor. You don't have a primary care doctor. 3 weeks later, the bill arrives. $4,800 for the 9 minutes. You call to ask about it. The voice reads from a script and tells you the balance is due in full. You ask about a payment plan. They offer you one at terms you already know you'll break. You are not a patient at level 1. You are a balance with a body attached.
Level 2. Medicaid. $200 to your name. You're covered now, technically. There's a card in your wallet that means you won't get the $4,800 bill again. But coverage and access are not the same thing. You call to find a doctor who takes your plan. The first 3 offices say they're not accepting new patients. The 4th has an opening in 11 weeks. You take it because 11 weeks from now is better than never. The day of the appointment, you sit in a waiting room that's fuller than the others, staffed thinner than the others. The doctor has 14 minutes scheduled for you and uses 9 of them. You mention the second thing you came in for, and you watch the clock win. You're not ignored here. You're processed. The card in your wallet is a key to a building, not to attention. When you check in, the woman at the desk scans it, and her face does the small thing you've started to notice. Not rudeness, a recalculation. She sees what you can't pay and adjusts how much of herself to spend. You leave with a referral to a specialist who has a 4-month wait. The system didn't refuse you. The system just made the door narrow enough that most people stop walking through it. You're not invisible at level 2. You're inconvenient.
Level 3. High-Deductible insurance. $2,000 saved. You have a job now, and the job has a plan, and the plan has a number you didn't read carefully until you needed it. A $6,000 deductible, which means you're insured for a catastrophe and on your own for everything else. You feel a lump and you don't go in because the visit, the scan, and the blood work all land before the insurance does anything, and you do the math instead of making the appointment. You wait a month. Then you go. At the desk, the woman scans your card, and the recalculation is softer this time. You're someone who pays. Slowly, but you pay. The doctor gives you 18 minutes. The scan comes back fine, and you feel relief and resentment at the same time because you just paid $900 to be told you're okay, and the not knowing almost cost you more than the knowing. You get the bill, and it's wrong. An itemized charge for a service you never received. You call. You wait on hold. You explain it twice to 2 people. They fix it, eventually, after you've spent your own hours doing the hospital's accounting. The system isn't cruel at level 3. It's just built to make you do the work it doesn't want to. You're not respected here. You're solvent. And solvent is enough to be seen, but not enough to be served.
Level 4. A real PPO. $15,000 in the bank. Something changed, and it wasn't your body. It was the plan attached to your name. You feel the same lump, the same fear, and this time you make the call without the math, because the math doesn't hurt anymore. The appointment is next week, not next quarter. At the desk, the woman scans your card and says good morning before you finished signing in. The doctor has the same 14 minutes everyone gets, but the scan is scheduled for tomorrow instead of in 6 weeks.
The specialist who made you wait 4 months at level 2 has an opening on Thursday because the plan in your wallet pays better, and the system routes its attention toward what pays. A bill arrives with a charge you don't recognize. You call once. It's handled in one conversation. No hold music looping, no explaining it twice. The same hospital that made you do its accounting at level 3 now corrects itself the first time you ask. You realize the building never changed. The wait, the rush, the narrow door, all of it was still happening. One floor down, to the person you used to be. You're not fought at level 4. You're accommodated. The system stopped making you work for the things it gives other people automatically.
Level 5. Premium coverage and $80,000 behind it. The hospital starts calling you before you call it. A reminder for a screening you didn't know you were due for. A follow-up after a visit. A real person on the line asking how you're feeling. You meet Diane. She's a patient liaison, a title you didn't know existed until you qualified for one. She gives you a direct number that doesn't route through the main line. The same institution that put you on hold for an hour at level 1 now has a person whose job is partly to make sure you don't wait. Your scan results, which used to sit in a portal for days, come back with a phone call the same afternoon. Quick break before this goes higher. If this is making you see the building you've been standing in differently, that's the point. At level 5, a fee shows up, and Diane makes it disappear before you finish the sentence. You're not just accommodated anymore. You're managed, gently, by someone paid to keep you. You're not a patient at level 5. You're a relationship the hospital has decided is worth maintaining.
Level 6. Concierge medicine. $500,000. The hospital stops being a place you go and becomes a service that comes to you. You don't sit in a waiting room because there is no waiting room at this tier. There's an appointment that starts on time with a doctor who has 45 minutes and uses all of them. Diane doesn't email anymore. Diane calls. And when she calls, she already has the specialist booked, the records sent ahead, the parking arranged. The physician knows your history before you sit down because someone was paid to brief them. You mention the second thing and the third thing, and nobody glances at a clock because the clock isn't the enemy here. Time is the product you bought. A test that takes a normal patient 3 weeks to schedule happens in the same building, the same day, down a hallway most people don't know exists. You're not being treated faster. You're being treated like the delay was never necessary in the first place, which it wasn't, for anyone, ever. The narrow door, the 11-week wait, the 9 rushed minutes, none of it was about medicine. It was about who was paying. You're not managed at level 6. You're protected.
Level 7. A private physician on retainer. $5 million. You don't have a doctor you visit. You have a doctor who answers. A number in your phone that reaches a human on the second ring, at night, on a weekend, because that access is the entire point of the arrangement. When something is wrong, you don't get triaged. You get a plan, that day, built around your schedule and not the hospital's. Diane is still there, but Diane now coordinates a team, and the team exists partly because your account does. The hospital flags your name across every location, so a facility you've never walked into knows who you are before you sign. The deals aren't on a menu. A procedure that comes with a months-long waitlist for everyone else is arranged in 48 hours because someone was told whose chart it is. The rules other patients live under aren't refused for you. They're quietly suspended. You sit in a consultation room with no logo on the door and a physician who isn't trying to move you through because there's no one behind you. The line that everyone else stands in, the one you stood in at level 1 for 6 hours, you don't know it's still there. You stopped being able to see it. The hospital doesn't follow its rules at level 7. It bends them around your name.
Level 8. The donor. $25 million. Your name isn't in their system anymore. Your name is on the building. There's a wing with your family on it, and the people who run the hospital don't manage your care. They consult you about theirs. The chief of medicine takes your call. The board knows who you are. 3 people inside the institution have jobs that exist, in part because of the check you wrote. And they don't know that, and neither do you, but the math is real. You don't request appointments. The appointment is whatever you need it to be whenever you need it. Diane introduces you to the person who runs the entire department, and that person flies out to ask what the hospital should build next. You're not receiving care at this level. You're shaping the place that delivers it. The same building that charged a body $4,800 for 9 minutes now asks your opinion on its future. And somewhere in that same building, right now, on this exact night, someone is sitting in the waiting room with a pain in their side and no card in their wallet, watching me hours pass, learning that the system isn't broken. The system is working precisely the way it was built to. You are the same person at every level,